Interleukin-17, IL-17, plays a significant role in the pathogenesis of axial spondyloarthritis, axial SPA. Axial SPA is a type of inflammatory arthritis primarily affecting the spine and the sacroiliac joints. The understanding of IL-17's involvement in this disease has been deepened through various studies, highlighting the following key points. 1. Pro-inflammatory cytokine. IL-17 is a pro-inflammatory cytokine produced mainly by T helper 17, Th17 cells. It promotes inflammation by inducing the release of other pro-inflammatory cytokines, chemokines, and matrix metalloproteinases, which contribute to tissue damage and the inflammatory process. 2. Bone remodeling. IL-17 has been implicated in the pathological bone remodeling observed in axial SBA. It can stimulate osteoclastogenesis, the formation of bone-resorbing cells, and contribute to the abnormal bone formation seen in patients with this disease. 3. Synovial inflammation. In axial SPA, IL-17 contributes to synovial inflammation, which is inflammation of the lining of the joints. This can lead to joint pain, stiffness, and swelling. 4. IL-17 pathway inhibition. Targeting the IL-17 pathway has become a therapeutic strategy in managing axial SPA. Biologic agents, such as secukinumab and ixekizumab, are monoclonal antibodies that inhibit IL-17 and have shown efficacy in reducing symptoms and halting disease progression in patients with axial SPA. 5. Half disease activity and biomarkers. Elevated levels of IL-17 have been found in the blood and synovial fluid of patients with axial SPA, correlating with disease activity and severity. This suggests that IL-17 could be a biomarker for disease monitoring and therapeutic response. Overall, IL-17 is a crucial cytokine in the pathogenesis of axial SPA, contributing to inflammation, tissue damage, and abnormal bone remodeling. Targeting IL-17 with specific inhibitors has provided new avenues for effective treatment in patients suffering from this debilitating condition. Interleukin-17 IL-17 also plays a protective role in the gastrointestinal tract, GIT. Its functions in the GIT are essential for maintaining mucosal immunity and protecting against infections and maintaining gut homeostasis. Here are some key aspects of IL-17's protective role in the GIT. 1. Mucosal immunity. IL-17 is critical for the defense against pathogenic bacteria and fungi at mucosal surfaces. It promotes the recruitment and activation of neutrophils, which are essential for controlling infections in the GIT. 2. Antimicrobial peptides. IL-17 stimulates the production of antimicrobial peptides such as defensins and Red3-gong. These peptides play a crucial role in maintaining the integrity of the epithelial barrier and preventing the colonization of pathogens. 3. Barrier function. IL-17 helps maintain the integrity of the intestinal epithelial barrier. It promotes the expression of tight junction proteins, which are essential for preventing the translocation of bacteria and toxins from the gut lumen into the systemic circulation. 4. Inflammatory response regulation. While IL-17 can promote inflammation, it also plays a role in regulating the inflammatory response to prevent excessive tissue damage. This balanced response is crucial for protecting the GIT from chronic inflammation and related disorders. 5. Interaction with gut microbiota. IL-17 influences the composition and function of the gut microbiota. It helps maintain a healthy balance of gut microbes, which is important for overall gut health and preventing dysbiosis and imbalance in the microbial community. 6. Protection against pathogens. In the context of infections, IL-17 is particularly important for defense against extracellular bacterial pathogens like Citrobacter rodentium and fungal pathogens like Candida albicans. It enhances the ability of the immune system to clear these infections effectively. 7. Role in inflammatory bowel disease, IBD. While IL-17 is protective in many contexts, its role in inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, is complex. In some cases, IL-17 can contribute to the inflammation associated with these conditions. However, its protective functions are essential for preventing gut infections and maintaining mucosal immunity. Overall, IL-17 is essential for protecting the GIT from infections, maintaining epithelial barrier integrity, and regulating the immune response to prevent excessive inflammation. Its balanced role is critical for gut health and overall immune function. Interleukin 17, IL-17, also has significant implications in ocular health and disease. Here are some key points about IL-17's role in the eye. 1. Pro-inflammatory effects. IL-17 is a potent pro-inflammatory cytokine in the eye, similar to its role in other tissues. It can contribute to inflammation in various ocular conditions, including uveitis, keratitis, and age-related macular degeneration (MD). 2. Uveitis. IL-17 is involved in the pathogenesis of uveitis, an inflammatory condition affecting the uvea, the middle layer of the eye. Elevated levels of IL-17 have been found in the aqueous humor and blood of patients with uveitis, and it contributes to the recruitment and activation of inflammatory cells in the eye. 3. Dry eye disease. IL-17 is implicated in dry eye disease, where it contributes to ocular surface inflammation. It promotes the production of other pro-inflammatory cytokines and chemokines, leading to increased inflammation and damage to the corneal epithelium. 4. Keratitis. In infectious keratitis, inflammation of the cornea, IL-17 helps to mediate the immune response against pathogens. However, excessive IL-17 can lead to tissue damage and impaired vision, highlighting the need for a balanced immune response. 5. Age-related macular degeneration, AMD. IL-17 may play a role in the development and progression of AMD, a leading cause of blindness in older adults. IL-17 contributes to the inflammatory processes associated with AMD, potentially exacerbating retinal damage. 6. Ocular surface immunity. IL-17 is part of the immune defense mechanisms of the ocular surface, helping to protect against microbial infections. It promotes the production of antimicrobial peptides and the recruitment of neutrophils to the site of infection. 7. Therapeutic target. Given its role in various inflammatory eye diseases, IL-17 is being investigated as a therapeutic target. Anti-IL-17 therapies, such as monoclonal antibodies that neutralize IL-17, are being explored for their potential to reduce ocular inflammation and improve outcomes in conditions like uveitis and dry eye disease. In summary, IL-17 has a dual role in the eye, contributing to both protective immune responses and pathological inflammation. Understanding its functions and regulation is crucial for developing targeted therapies to treat inflammatory eye diseases while preserving necessary immune defenses.